Hello, everyone. Thank you for joining us today. I'm Kathy Roth-Duquet, co-founder and CEO as Blue Star Families. As a leading nonprofit for military and veteran-connected families, we at Blue Star are committed to transparency and bringing you the answers and information you need to help your family thrive. We've got an amazing lineup for you today of some of my favorite people, really, so I'm excited. We'll be asking you your questions from the chat and get your comments, as well as talking to our live panelists and bringing in the questions that you asked when you registered. We'll be giving you links to all the resources we mentioned in the chat too, so don't worry about writing things down. Both Blue Star Families and our partners today have staff in the chat to answer your questions and provide resources. Don't be shy, let us hear from you. So without further ado, Dr. Fauci, we are so excited to have you back speaking with Blue Star Families again.
Thank you. It's really good to be with you again. Thank you for having me.
As we like to say here, you have been one of BSF's BFFs, and we hope you feel the same about us.
Very much so, yes.
Well, thanks for coming to share your expertise with our military-connected families once again. We know you're headed to a time of transition as you retire, and we're excited for your new chapter. We want to wish you all the best and let you know that at the end of this, we're going to be sending over one of our famous Blue Star Family Yeti mugs as a parting gift. We hope you stay hydrated in retirement.
I'll try my best.
Okay. Well, I want to get to our questions because we've got a lot of them for you, as always. First of all, some of our members want to know, how are you feeling? How's your recovery going after your recent COVID-19 case?
Oh, very well. I was fortunate in that I recovered well and completely and pretty quickly. I have no residual symptoms. So the whole idea that some people get what's called long COVID, I've been fortunate enough that I recovered completely and have no residual symptoms. So I feel essentially back completely to normal, which is a good thing. You know, given my age, it was recommended, and I followed the recommendation of taking Paxlovid, the antiviral drug that is really quite effective in keeping people from progressing to the point of requiring hospitalization. And if you look at the data on that, it's about 89 to 90% effective in doing that. So I would imagine given my age, that if I had not taken Paxlovid, there would have been a reasonable chance that I would have had a much more severe course of disease than I had. And it was actually relatively mild.
Were you concerned at all about that rebound COVID that some people get with Paxlovid? Did that come into account for you in deciding to take it?
Well, it didn't, but I did rebound, by the way, actually. But it was really not anything of any concern because Paxlovid did what it was supposed to do. It was keeping me from progressing to severe disease. So what happened, I took it on the first day of my symptoms, and I tested myself that day with the rapid antigen test, and it was strongly positive. I started on Paxlovid, which is a 5-day course. And at the end of that, I turned negative with my antigen test and remained negative for 3 days. And then on day 4, much to my disappointment, I had a rebound. But the rebound really wasn't bad. The test returned to positive. I had about 18 hours, 24 hours of sniffles in the nose, a little bit of a sore throat, and a very, very mild fever that lasted only about 12 to 18 hours. And then after that, I was fine.
That's great. Well, we're glad to hear you're better. And I think this is part of what so many of us are coming to terms with in terms of living with this disease in our system. So here, some other questions. We have an active duty Army spouse in San Antonio, Texas, who says, can I get the flu shot and the COVID-19 booster at the same time as a combination, or would it be better to separate them out?
Well, that's a great question. A lot of people are asking that as we're entering into the fall season. when both flu and the booster shot will be available. And the answer to the question is yes, you can get them at exactly the same time. And in fact, that's what I myself plan to do. Probably in the first week in October, I will get my booster shot with the new BA5 bivalent boost that will become available in about a week and a half right after Labor Day, at the same day that I get the shot for flu. So I will kill two birds with one visit.
Yeah, that sounds great. You know, I got my second booster at the beginning of August because I had gotten COVID when I was eligible for the booster, so I had to wait till August. Should I wait 3 or 4 months before getting this newer booster then?
I would wait 3 months.
3 months.
Yeah, I mean, there's nothing set in stone.
Mhm.
You would likely hear different versions of it from different people because there's no definitive answer to that question. But if you were boosted before or infected before, I would wait at least 3 months before you get it.
Super. We've got one of our folks on the line now from Middleburg, Florida, who's saying, are there any interactions between the COVID-19 flu and the monkeypox vaccines that we should be thinking about?
The answer is no. And when you say thinking about, you really don't need a monkeypox vaccine unless you are in a category that's really at a high risk. So monkeypox vaccines are not being recommended for the general public as a broad vaccine recommendation.
Okay, great. Question about updates. And there's been a lot of changes since February when we spoke to you last. You just talked about the next Omicron vaccine. Is there anything else about new vaccines, new developments that it's a good time for you to update us on?
Yeah, well, there's a bit now of, I would call it a relaxation of the restrictions upon people who've been either exposed or who've been infected about getting back into society. Instead of, for example, being isolated for a full 10 days, you can be isolated for 5 days after you've been infected. And if you don't have any symptoms, you can go out into the workplace, into society after 5 days, provided you wear a mask until day 10.
Mm-hmm. Yeah, you know, it's interesting. We were just out on family vacation, and as sometimes happens, my kids, who are both college students, both got sick. We took COVID tests. They didn't have COVID, but they did have little fevers and lots of congestion. And, you know, it turns out you can still get sick even without having COVID. So, you know, I think that's one of the interesting things for us all to remember going into the fall too, right?
Oh, well, absolutely. And that's the reason why now that we have tests that are readily and easily available, you know, we have now literally tens, if not hundreds of millions of tests that are available, that if indeed you do get symptoms, you are right. If you just turn the clock back prior to COVID, many of us almost routinely would get some sort of a sniffles or a cold at one time or another during the fall and winter, which is the time when it's most likely to have a respiratory-borne disease. And that's the reason why we recommend you get tested. And if you are positive, then follow the recommendations of the CDC for isolation.
Yep. So speaking about the fall, a lot of our members are thinking about back to school. Should the children continue to mask?
Well, it depends on where you are in the region of the country and what the level of dynamics and density of infection is. And the CDC, as you know, has a color-coded map of the country where you have green, yellow, orange, and red, where in certain parts, when you have a high level of virus, masks are optional. And in other regions where you have a high level of virus, masks are recommended. Whether or not you have to wear a mask is going to be dictated at the local level. by the local health authorities, including school authorities.
Thank you. Do we expect that COVID cases will become less severe as it's more and more part of our population, or is that not something we can look forward to?
Well, if you stay within the same general framework of the isolates not being too different from each other, after a while, you'll get such a large proportion of the population either vaccinated, hopefully vaccinated and boosted, and or infected and hopefully boosted after infection, so that there'll be a degree of protection in the community such that when your person gets reinfected, it is much less likely, unless you get a completely different virus of SARS-CoV-2, if you get one that's a subvariant of the ones that are now recurring and you have a degree of background immunity, it is very unlikely that you are going to have a severe outcome, particularly if you are up to date on your vaccination. So it isn't a question of the virus inherently becoming less severe. It's more that the protection level in the community is much more prevalent than it was like a year or two ago.
Yes. Well, so this next question is right on the heels of this one. We have a retired Air Force spouse from Sterling, Virginia, nearby, asking that after being doubly vaccinated, boosted, and really careful, we still got COVID-19. Can we keep getting it over and over again? Is there anything we should be doing differently?
Well, you should not necessarily be doing anything differently, but doing what it appears that person was doing, was staying up to date on your boosters. One of the things that we've learned about coronaviruses long before we were challenged with COVID-19 was that for one reason or other, the immunity against infection with coronaviruses is not very durable. This is in contrast to the immunity, for example, to measles or polio or smallpox for that matter, where once you get infected, the durability of protection against repeat infection literally goes for decades, if not for an entire lifetime.
Yeah.
That has not been the experience with coronaviruses, that the durability of protection, even against the same virus, does not last very long. What does happen is that if you get reinfected and you have a degree of immunity that did not necessarily protect you against infection, will likely do a very good job of protecting you against severe disease that might lead to hospitalization.
Very interesting. One of our viewers right now is asking, we understand now that we're susceptible to pandemics as a culture. Is there anything we can be doing now to prepare for the next pandemic, something other than COVID?
Well, first of all, we have a pandemic preparedness plan that the federal government has put together. That's an all-of-government plan to be able to respond nimbly within 100 days with vaccines and therapeutics if we do get a brand new infection. So there's simultaneous a scientific preparedness, and we did a very good job of that with COVID because we had decades of investment in biomedical research, which allowed us to get a very good jump start on the development of vaccines. And that's the reason why, as you well know, from the time the virus was first recognized in January of 2020 to the time that we had vaccines that were highly effective and were able to be given to people, it was 11 months, which is totally unprecedented in the rapidity in which that was done. We have to continue to do that type of preparedness for the future outbreak. also, as a broad civilization, we need to pay attention to the animal-human interface, because 75% of all the new infections, particularly viruses, are zoonotic, which means that they jump species from an animal reservoir to a human. And that's how we get most of these new infections. So we've got to make sure we don't encroach inappropriately upon the animal-human interface.
Yeah, and certainly we're hearing a lot of questions about monkeypox, and I'd love to hear your thoughts about that. But then also, are we going to expect giraffe pox and hippo pox next?
Well, I'm not so sure that you're going to call it that, but I think you can expect in the future that there will be more viruses that jump species and infect humans.
Yeah.
That's what happened with HIV. That's what happened with Ebola. That's what happens with influenza. And that's what's happened with COVID. So yes, we can expect that there will be more of that, dating back to what I said, is we need to respect that animal-human interface and not put the human species in direct contact with animals that are very unique in their lack of having had contact with the human species that may harbor viruses that would jump species and infect humans.
Yeah, oh, that's interesting. Listen, while we're talking about emerging concerns, some of our listeners from New York have raised questions about the reemergence of polio that they've experienced there. Is that something that families should be worried about now? And what can we do to keep families safe from polio?
Well, we have a very simple and highly effective response to your question, and that is get vaccinated with polio. If your children have been vaccinated, you're in good shape. The vaccine for polio that we use in the United States is 99% effective. And the case that has gotten a lot of publicity in New York of paralytic polio was in a community in Rockland County in which the level of vaccination against polio was unacceptably low. It was about 60%. And in some areas in that county, it was as low as 37%. We've got to get the vaccine rate among children over 90%, well over 90%.
Super. From our audience right now, will the Omicron-specific booster be available for kids 6 to 11? What about for under 5s?
The Omicron variant now booster will be available for children 12 and older for the Pfizer, and 18 and older for the Moderna product. Right now, we're looking at the possibility of getting that booster for younger children.
And are we thinking 3 months, 6 months? Any sense of that?
I think it's going to be a progressive age decrement as we did with the regular vaccinations.
Okay, yep. And any advice about coping with making rapid shifts given incomplete information about new disease variants? One of our listeners asks.
Well, I'm not sure what you mean by rapid shifts. You're talking about a rapid shift in getting a new vaccine? And if the answer, if that's the question, that is one of the great advantages of using the mRNA technology, in that it is highly flexible. And as soon as you realize that you need a new boost for a new variant, you can often have that available literally within months. Mm-hmm. And that's exactly what happened with the new bivalent booster with the BA.5 Omicron subvariant. So the new platform technology of mRNA is doing exactly what we hoped it would do, is to provide a high degree of flexibility to move quickly to make a change.
Super. Thinking about your upcoming retirement, I'm curious what advice you have for the person or people who succeed you.
Well, I would suggest they do what I have tried to do over the last many years that I've been director. I've been the director of the Institute for 38 years. I've had the opportunity to be in the middle of the battle, as it were, against multiple outbreaks dating back to HIV/AIDS, to pandemic flu, to the anthrax attacks, to Ebola, to Zika, and now to COVID-19. And what I've done is stick with the evidence and the data and the science, stay out of politics. You're going to get involved in recommending policy, but stay out of the politics of it, because we've learned painfully that when you get political divisiveness like we have now in our society, it's detrimental to an optimal response to an outbreak.
And I'm going to add that I hope that the next person remains as committed to being a communicator as you are. I know it's meant a great deal to me and to our whole community to have you so available to talk to us, and it gives us a lot of comfort. So I just want to reiterate that.
I'm happy to do that. Thank you.
And let me ask you, what are your plans for keeping yourself healthy in retirement? A lot of wellness is having a mission, and you've had an enormous mission for all these years, for half a century. What are your plans for yourself?
Well, I'm going to stay very active, and I think that's a good way to stay healthy, is to stay active. That's one of the reasons why I decided to step down now, because while I still have the energy and the commitment and the passion, I'd like to move on out of the phase of the federal government and more into being able to spend a lot more time using the experience that I've gathered over the last 54 years at the NIH and 38 years as the director of the Institute to inspire and hopefully encourage younger people who might be considering a career in public service, to encourage them and use the benefit of my experience to get them excited about a career in public service in the realm of public health, in science and medicine. I'll do the same things I do now, but hopefully not as intensively, because if there's anything that I do that's unhealthy, it's that maybe I push myself a little bit too much. Hopefully, I'll be able to get a lot done working, but not push myself to exhaustion every day like I have over the last several years.
And for some of our young people, some of our military children perhaps, or those who are just coming through college, who are thinking about careers relative to health, what advice would you give them, or how would you have them think about their future?
Well, if they have any interest in science, medicine, individual health, or public health, I can tell you from my own experience that it's not for everyone. But if you happen to feel that this would be something for you, you should give it a try, because it can be extraordinarily gratifying and fulfilling to do something with your life whose end game and purpose is to help preserve the health and the wellness of the American public.
And if you don't mind giving us just a couple more minutes, because I think our audience is really interested, what inspired you to get started in this career so many years ago?
Well, I am very much of a people person, and I wanted to do something that put me in contact with people, hopefully in the context of serving them, because my training from my parents and my education in high school and college under the Jesuit training, the theme of all our training was service to others. And I wanted to do that. I got interested in science and biology, which created my interest in medicine. And I felt the best way to have a combination of adding science to my desire to be very much a people person, it seemed that the field of medicine was exactly what I wanted. However, as I got into it and trained with my internal medicine training and then my infectious disease training and my immunology training, and then my public health involvement as I became director of the Institute, I realized that a lot of opportunities get thrown in front of you that you don't plan, that are really something that are unexpected. And that's been one of my mottos, is to expect the unexpected. Because if you are alert enough and nimble enough to use those opportunities, a lot of exciting things can happen to you. And that's where I actually wound up where I am right now. I never really planned that from the beginning. I had originally planned to be a physician that went back to New York City where I trained and to take care of patients in a private practice. But it just didn't turn out that way because of the opportunities that were put in front of me and which I snatched.
I think that's a wonderful message. That, and I saw something recently that said most of the most successful people did not plan out their path, but they responded to opportunities. And I think people are often thrown by how unpredictable the world can be, but that unpredictability also has so much opportunity, right?
Right, and excitement.
Yeah, and excitement. Well, as you go on to this next stage, please keep us at Blue Star Families in mind. If there's any way we can stay connected to you or be helpful to you or be part of your new plans, we'd love to. And in closing, I want to not only thank you for sharing your time, but just ask you if you have any final thoughts you'd like to share or anything you'd like to leave us with.
Yeah, I want to make sure that your listeners in the Blue Star Families and those surrounding them is that this is a very difficult time we've been through. It will end and we will get back to normal. Hopefully the sooner rather than later, and we can help that by doing things like getting vaccinated and encouraging our friends and family to stay up to date on booster. The sooner we do that and the more completely we do that, the faster we'll come to an end to this very difficult challenge we faced over the last 2.5 years.
Well, thank you. And it's great to see you. And I look forward to your next change.
Thank you. Thank you. Good to be with you. Thank you for having me.
Bye-bye.
Bye-bye.
And now moving on to the next stage of our hail and farewell. In many ways, that was our farewell to a great leader who we wish for all the best as he heads into his retirement. We look forward to keeping in touch with Dr. Fauci in the months to come. Moving on now to our hail, this part of our hail and farewell. I'm honored to be joined by a great friend, the newest member of the leadership team of the Department of Veteran Affairs, Dr. Sharif Elnahal. Dr. Sharif joins the VA as the Undersecretary of Health, a very, very important position for all of us. We're really pleased to have that filled and filled with someone who is so capable. Sharif, thank you so much for joining us today and congratulations on the new position. I'd love to have you introduce yourself and tell our audience a little bit about your priorities as you undertake this really important role.
Well, thank you so much, Kathy. And it's so great to join you and all of your colleagues at Blue Star Families, such an incredibly impactful organization. And I've had a chance to learn all about it from Kathy, but also from folks that I've met in the field, veterans, their family members, and folks who ultimately support people serving currently on active duty and otherwise. And really just want to make sure that I communicate to you that your impact is already being felt by me as a new leader here in VA. I want to just introduce myself and my experiences that sort of brought me up to this point. I wear a few hats in my life that I think prepare me for this undertaking, which is an incredible responsibility, really the honor of my professional career. The first hat is really of a patient. So I'm somebody who has had type 1 diabetes now since I was 12 years old. And I know how taxing that can be to live with chronic disease and to live with a condition, even for somebody who's been as privileged as I am, and having all the access to healthcare I've ever needed throughout my life. That perspective of living with a chronic disease is something that so many veterans and family members and caregivers contend with every day. And so I have a unique look into that just from my own life experience. The second hat is that of a clinician and a physician. So I remember one of my first clinical rotations in medical school was actually at the West Roxbury VA in Boston, Massachusetts. And I was faced with a veteran as one of my first patients who was clearly having a heart attack. Veteran knew it, we knew it, had driven over an hour with crushing chest pain just to arrive at that facility. And so one of the things we asked him after he was stabilized was, you had a lot of opportunities to stop in an emergency room and get emergency care. And he knew what he was having because it was his second or third, frankly, episode of this. And he said, I would never go anywhere else for my healthcare because VA is the place that I trust. They understand what I did to serve this country. So many people like me work for the VA, and I will never get my care anywhere else. And that really spoke to me, not just as a physician, but as a budding professional, such that I really wanted to work for organizations that had that effect on people for the rest of my career. And so I bring that perspective as well as a clinician. The third hat that I wear is of a physician, leader, and administrator. And so I've had different experiences that have led me to this point. First, having gone through leading a hospital in northern New Jersey through the pandemic, and having two episodes where heroes in uniform came to our assistance as the state hospital, the safety net hospital, serving the city of Newark, women and men who were, in the first instance, U.S. Army reservists, in the second instance, active duty U.S. Army clinicians coming, working side by side with our team. And they were really embedded and became part of our family. I set up a field hospital during the pandemic, the worst of it, in northern New Jersey, alongside the National Guard. And so I was just so thankful for what they did for our community and for my staff that I asked, their leadership, what can I do to repay you? What can I possibly do? And they basically said, look, we know you've been at the VA before, so pay it forward. Try to go back there and do the work you're doing here for veterans and families. And so it's a really sort of an honor for me to be here in that context. Kathy, I'm happy to go into my priorities and enablers now, but if you want to go into questions first, I'm happy to do that.
That would be terrific. I appreciate it because we are getting a lot of them. But I also want to thank you for sharing your story, the background about your chronic disease. I think there's something very builds a lot of trust about knowing that you've walked in the shoes of so many of the folks who are seeking care from you. I also want to mention that there's something for me as someone who advocates on behalf of families. You have a young family, a beautiful young family, and I know that you bring a family perspective to healthcare and wellness as well, and that for the veteran, that family is part of the equation.
Very much is. That's my entire life outside of work. I still put my kids to bed every night, despite how taxing this job is, appropriately so. There's so much work to do for veterans, families, and caregivers. But I have 3 kids, age 6, 4, and 2, wife who's my best friend, and that's my life outside of work.
Well, that's awesome. And I know, Blue Star Families, we do a lot of research about what creates resilience. And we know that one of the top factors that creates resilience in an individual is the amount of positive time they spend together with their family. So good for you. From our perspective, you're doing something that's going to keep you able to stay in the fight for us. And related to that, so many of the questions that we've gotten for you and relative to the VA are about the topic of mental health access at VA. And I know that mental health access is a high priority for all of you at the VA for our veterans. I wonder if you could tell me a little bit about what you're seeing right now.
So my top clinical priority, as has been the case for other people in my position and secretaries of the VA, is preventing veteran suicide. I consider every instance where a veteran dies by suicide to be a tragedy. And of course, before that happens, there are so many leading indicators and opportunities to intervene on behalf of veterans and families, inclusive of mental health access. But even before that, in the trajectory of someone's journey from their time in service into transition and back into civilian life, is really in the communities and the support networks that they have. So VSOs, being the incredibly important organizations that they are, and MSOs, have a lot of tactical knowledge and skills in helping veterans and service members navigate these processes. But I think among the most protective roles that all of you provide is that support network around soldiers who end up becoming veterans. And I'll tell you, the outposts that VSOs have, the communities that they build, I want to make sure that we are doing as much community-based intervention and integration into those networks of trust as possible. Because where we can prevent and really take out veterans from that journey into ultimately taking their own life, a lot of that work can be done on the community-based side. And the John Scott Hannon Act really outlines incredible provisions for us to follow. We have a great implementation team for that. And our mental health and suicide prevention teams are very much focused on this.
That's fantastic. I know you have a busy schedule. I have to let you go. But before I do, I wonder if you could touch on some of your front burner priorities as you look forward to the next 6 months or so of your position.
So I will say that we have a lot to work on in VA to do better and better for veterans. That is not to say that there isn't daily excellence that is happening across the system. And I think many of you are well aware of that excellence. But we have a lot of work to get done. And so first and foremost, and this may sound like a little bit of an internal shop priority, but it's just so important to everything, is hiring faster and more competitively. The VA struggles with bringing on people on time, and with the job market the way it is for extremely talented and scarce folks in healthcare, we have to really streamline that hiring process and make sure that the often hundreds of people that line outside our job fairs across the country can actually get in the door when they raise their hand and want to serve veterans. The second is really delivering the soonest and best care options to veterans. And that means empowering folks in the field, in clinics, at call centers, to really have all the options for veterans and families available right in front of them with their workflows and systems, so that they can actually more easily connect that veteran to the next best step in their care. Regardless of these debates on internal versus community care, if we're able to do that with VA having the 90% trust scores that we have among veterans, we will be able to really fill the direct care system with more services for more veterans. Third, and extremely importantly, serving our veterans with toxic exposures. The PACT Act is an extremely important, really generational piece of legislation that finally ends the fight for so many advocates who have fought to get veterans the benefits they deserve after the damage they've suffered in their deployment theaters. And we have a lot to do on the VBA side in VA, but we also have to prepare our delivery system within VHA, our healthcare system, to serve those veterans. The fourth, and extremely importantly, we are going to continue and accelerate our journey in high reliability. The patient safety frameworks, the cultural frameworks for allowing anybody to raise their hand, stop the line, and call out a patient safety issue that may end up affecting your veteran. I want to turbocharge that as much as possible. Then comes treating the whole veteran, their caregivers, and survivors. And of course, all of the issues with the caregiver eligibility criteria, we have to address that, and we will. And then, as I mentioned before, our top clinical priority will be preventing veteran suicide and increasing access to mental health.
Yeah, it's an inspiring group of priorities. One thing I want to call out in particular, and this is going to be reflected in our next panel, is that intersection between the DoD and the VA, and I think especially around the PACT Act. We're having so many service members. You contracted your chronic disease in the course of your service. Maybe you're getting treated during service, and then you have to transfer to the VA. We're seeing this in real life at Blue Star Families every day with people dealing with that. And that's a very difficult transition from the DoD care to the VA care in the midst of that chronic challenge. So thank you for making these your priorities. And we're excited to be a partner with you as you chip away at them. And thank you for making it a priority to spend time with the community so soon into your tenure. We're excited to have you.
Thank you so much for the time, for your time. And I really look forward to meeting as many of you as I can and really pushing the system to serve your family members, caregivers, veterans, and everyone in between better and better over time.
Thank you. Take care. Super. Well, our next panelists are senior leaders at the Department of Health Agency and the Department of Veteran Affairs. One of the things that is a priority for us at Blue Star Families and so many of our colleagues and other leaders across the White Oak Collaborative is this idea of connecting the dots between DoD and VA, which affects all of our community. So in their respective agency, the leaders who are with us today are currently serving and our veteran families, overseeing their overall health and well-being. Dr. Jane Kim, who is the Executive Director for Preventative Medicine at the U.S. Department of Veteran Affairs. She's been with us before. Thank you for coming back, Dr. Kim. Lieutenant General Ronald Place, you've been a great friend of us and this platform, Director of the Defense Health Agency. We're so delighted to have you back. Lieutenant General Place and Dr. Kim are here answering your questions and getting the answers that are most important to our community. Thank you both once again for joining us.
You're welcome.
Okay, super. Well, I am going to get right to our audience questions because we have so many of them, and I'll if it's not obvious which one of you it's for, I'll let you know. So first of all, I think this would be for Dr. Place. What is the military doing right now to encourage service members and their families to follow through with getting vaccinated and boosted for COVID-19?
Well, yeah, thanks, Kathy. Thanks for having me again. For service members, we're both encouraging and requiring vaccination against COVID-19. When it comes to infectious diseases for the military, I think it's pretty apparent, but we're often very close together, and individual threats often become threats to the unit effectiveness, threats to the mission. So whenever we have the benefits of an approved vaccine that can prevent infection or reduce the severity of disease, we use it. And that's part of what we call medically ready. Right now, about 98% of our total joint force is vaccinated against COVID, and that's great. For families, on the other hand, it's not a requirement, completely voluntary. So we're using every tool that we have to help. But the most effective, the best tool that we have is the individual communication between the trusted provider and the patient. And we believe that's the most effective way to get the most current information and the most accurate information to our patients. What we know right now, though, is there's too much information sometimes, right? It can be overwhelming. And so I think this part of my job, part of all of our jobs, quite frankly, is to remind everybody just how important, just how much of an improvement vaccines have led to where we are today. You heard Dr. Fauci talking about it just a little bit ago, how those of us who are fully vaccinated and boosted when appropriate, we're less likely to go to the emergency department. If we are infected, we're much less likely to be hospitalized. We're much less likely to die. So vaccination, great thing. From what we're reading, and again, Dr. Fauci mentioned just a little bit, the coming boosters look like they're going to be even more effective. So those are the types of things that we're talking about. As just one little aside, one of the challenges that we're seeing, at least in the Department of Defense, based on all the discussions and again, as Dr. Fauci mentioned, the politicalization perhaps of vaccines, is we're seeing somewhat of a decline of vaccination rates of all vaccines, in particular about our children. So my advice to everybody as a doctor, as a father, and I guess I'm a little older, and as a grandfather, if there's an approved vaccine and you're eligible to get it, COVID or any of the other ones. So thanks for the question.
Yeah, no, I appreciate that. And, you know, it's true. I think some of the controversy about the vaccine has made people look askance to other vaccines, and I think none of us want to backslide like that. Dr. Kim, this one's for you. Has hospitalizations or death rates related to COVID-19 decreased in the VA at the same rate that they have in the civilian system?
The good news is yes, that we have seen decreases in both hospitalizations and deaths this summer, very similar to what we see in the general US population. I was just looking at that data this morning and was reminded about how challenging it was in 2020 and 2021 with high rates of hospitalizations and very unfortunately deaths. We saw that as well in the VA healthcare system. But thankfully, after the most recent surge this January, we did see a downslope in hospitalizations and in deaths. Even with a small bump this summer, we are continuing to go down over the past few weeks. So that is great news. I know every statistic in that direction with good news we take and grab onto. So my hope is with these new boosters that we will get more of our veterans protected and keep those rates down throughout this fall and winter.
Super. Dr. Place, I have got a reserve spouse in Overland Park, Kansas, who's asking, what's being done to destigmatize mental health conversations from within the military, that despite all of the conversations that we're hearing, there's still a feeling that this could harm someone's career?
Yeah, thanks. That's a great question. The work of destigmatizing mental health, behavioral health is really a responsibility for all of us, and not just healthcare providers, but unit commanders, family members, friends, really all of us. I think many of us have done a lot over the last several decades to try to move in that direction, and I think there are signs that we are actually moving in that direction. But in terms of how do we know we're destigmatizing it, well, we can measure it a little bit, and one of the ways is, so you're recommended for an appointment, do you actually make an appointment, and you actually go to the appointment? And over the last several years, we continue to see the percentages of those who are recommended and then actually show up for appointment. But in my personal opinion, sometimes it's just setting the example. And I have a great story about that. General Mike Minahan, 4-star, right? So really, really senior guy in the Department of Defense, commander of the Air Mobility Command in the Air Force, put his behavioral health appointment out on social media. He put it out there, right? Tuesday, 1 o'clock, mental health appointment. And he wrote a simple note to go with it. It said, warrior heart, no stigma. And that got a lot of attention, which I think that's what he's hoping for. All of us have a role in telling our friends, our families, our patients, whoever, that mental health care is medical care. It's right. It's part of all of us. And if there's some part of us that isn't right, getting the care to get better is part of it. And that's what we're working toward.
Yeah, that's certainly impressive. I hadn't heard about that. But yeah, that's amazing. And I think this is perhaps related. I've got an active duty Navy spouse in San Diego asking, where could you get non-emergency medical health help? I'm looking for support, but I don't want to burden the system. Is that something I should be concerned about? Well,
first, I think it's remarkable that the spouse doesn't want to burden our system. No one should delay care, no matter what it is, even if it's not life-threatening, whether it's physical health, mental health, doesn't matter what it is. We delay things, it gets worse. I appreciate the compassion that led to the formation of the question, but it shouldn't be hard at all to find care in most places where we have military installations. You can go to online or call the local MTF. It's for service members and their families. There's no requirement, though, to use our MTF. So if they want to, they can go to the 1-800 number for our TRICARE partners in the TRICARE network, whether it's here in the United States or overseas. They can also go out of network if they want, although the usually costs a little bit more if people go out of network. And then there's other resources. Military One Source is a great partner to us that offers certain counseling services that are separate from TRICARE. Military Family Life Counselors is part of Military One Source, and they often don't keep records. So people are worried about a record being kept of the discussions that they're having, the counseling, that sort of thing. And then while the question mentioned non-emergency services, I'll remind all of us that we've transitioned a little bit, but there's a new national number, 988. It replaces a suicide hotline, but it's more than that. It's really for everything, certainly suicide, but just emotional distress or substance use disorder or mental health challenges. All those things are all out there. That said, I'm not going to pretend that I can just, say all that or wave a magic wand and you can get an appointment. As Americans, not just in the Department of Defense, but everywhere across the country, mental health access can be a challenge in some communities, and in some locations, there's just not enough there. So then the last I guess, part of it, and that's telehealth or telebehavioral health. And where can we use technology to link up those who are in a behavioral health or mental health treatment desert with those locations that are in a behavioral health, mental health oasis? And can we connect them using technology? So overall, if you need it, then there's lots of ways that we can help you get it. If you feel like you can't find it, then contact your MTF and let us know what we can do to help you find it for you.
Super. Thank you for that. And a related mental health question for you, Dr. Kim, and then I have another one following that back on the COVID. This is from an Army veteran in Ohio saying, my family has been affected by my service. Is there any way that the VA can be helpful to them with their mental health challenges?
Yeah, that's a great question. You know, I know that there are services for family members of our veterans who get care in VA. I know some of my patients bring their families to couples counseling. They also have other family members join them in sessions to really have that whole round approach. You know, giving the veteran the best care they can get is absolutely our top priority, but they live with a family. They have family members who are affected, as you said. So I know there is definitely support in the clinical arena for their families. There's likely also support for those family members through other channels as well. I know there are some support groups that exist, whether VA affiliated or not, for those family members of people who may be, you know, having mental health conditions that are impacting their families. So just a number of different ways that we recognize that it's a family issue, and getting everyone together to help our veteran helps the whole family.
Thank you. And then on a different tact, got a question from the audience. I have some concerns about mRNA technology. Some other people I know have concerns about that. Are there new options for non-mRNA vaccines?
The good news is yes, there are. There was a vaccine that recently was released and is out and available, made by the Novavax company, that does not use mRNA technology and is available in a 2-dose primary series, just like the mRNAs were. So that just came out pretty much in August. We have it in VA hospitals and clinics, but it's also widely available. So if people either had an allergy to mRNA vaccines or a concern about them, they now have another option, and it is out and available. And so I just encourage people to check that out.
Wonderful. Thank you. I'm shifting through all my questions because I'm back with only one left to ask, Dr. Place. This is going to be for you. Well, I'm going to ask you a compound one just so I can get a little bit more in there. We have an Air Force spouse from Surprise, Arizona, asking, with so much conflicting information, what scientific research organizations do you recommend as the most reliable? And then after answering that, perhaps you can address what some of your priorities are for the rest of this year from the perspective of the health agency.
Sure. Yeah, that's a great question. I think one of the hardest things we can do is try to determine what's the measure of trust that we can have on any medical information. So I'll be careful when I'm talking about private organizations, but when it comes to government organizations in general, there's some terrific resources. I think the state of the art, top of the heap is the CDC. Now, the CDC is, quite frankly, over the summer, they've mentioned they haven't gotten everything perfectly right over time, but in general, they have been very right all of the time. So for me, when it comes to public health in particular, but for other diseases as well, the clinical trials that the CDC is leading, et cetera, there's so many things that they're doing the right things on. So from a public health, preventive medicine, it's the CDC. When it comes to cancer research or what are the right chemotherapies or those sorts of things, then I don't know if Dr. Fauci is still listening, but the National Institute of Health, they have incredible resources available for all of us to read about particular disease processes and things that can be done. What are the likelihood of successes behind them, and what are the other questions perhaps that we should be talking to our practitioners, providers about? On the other hand, while it may be entertaining, we have to be careful about social media. And I'm not going to call out any of the social media sites, But if you're looking to see what other people think, not what science says, then social media is pretty good about that. And maybe it can lead to some questions that you can ask a particular provider after you've read through the information from the CDC or the NIH, et cetera. But careful about what we read on social media. Be more trusting in things like the NIH and the CDC. And then from a priorities perspective, we're still having a priority of all the ramifications of COVID-19. Now, similar to the VA, we also have seen decreasing amounts of infection, decreasing hospitalizations, that sort of thing. But it's not like it's gone. It's just less of it. But in addition to that, the whole transformation of the military health system is still ongoing. Partnering with Army medicine, Navy medicine, Air Force medicine, still a high priority for us. We're in the final phases of rolling out our next generation electronic health record. That should be done in another 14, 15 months, something like that. So we feel very comfortable that we've transitioned from a very old legacy electronic health record to a state-of-the-art electronic health record. We're looking at how we're balancing where we have our people, where we need to have our people, and do we have the right people, the right expertise at the right location so that we can best take care of our service members. And then we're iteratively going through all the contracts. We have this suite of TRICARE contracts. Do we have the right contracts for the right reasons with the right companies, whether it's the managed care support contractors, currently Humana and HealthNet here in the United States, International SOS overseas, Express Scripts for our pharmacy programs, TRICARE Reserves, TRICARE Reserve Select, et cetera, the whole suite of them. So we're continuing to go through the integration that we have from our on-installation healthcare with our off-installation healthcare partners to make sure we're doing everything that we can to provide high quality, safe care with great access to those who wear the cloth of our uniform today and those who wore it in the past.
That's wonderful, and there's an awesome range of priorities. I think it gives us all a sense of how much you have on your plate. Want to shout out that transition during chronic care from DHA to VHA, which continues to be such a challenge, understandably. So thank you for your amazing work that you're doing. Dr. Kim, any last words or any last thoughts you'd like to leave us with?
I will just say thank you to all of the veterans, active duty military members, and their families for their service. The reason I joined VA is to serve you. So thank you so much. We at VA are here for you. So if you have anything that your veteran needs, please go to va.gov. I like that website for some information. It's a very easy to use website, and I encourage people to go there. But thank you for having me.
Super. The volume of questions was very high. We hope we can get you all back to talk with us again because it's super popular among our group. We're always so thrilled to have you both with us. Thank you for spending time with us today, and we appreciate you and look forward to seeing you again.
Thanks for having us.
Okay, so I am delighted to move on to the next segment of our program. Sesame Workshop is our next partner. It's my pleasure to introduce our next guest, who comes from one of our very favorite neighborhoods, Sesame Street. Coming from the Sesame Workshop, which is the nonprofit behind Sesame Street, Dr. Jeanette Betancourt's work is all about children's early learning, health, and well-being. She provides strategies and resources along with her colleagues to parents. Today, we're talking with Jeanette about how to meet the social and emotional needs of military kids during times of transition. We know about 1/3 of our military kids have moved this past summer and are settling into a new school year. We'll have a chance to hear from some of our friends at Sesame Street as well. So let's get started. Welcome, Jeanette.
Thank you so much, Kathy, for having me here. And also, as you could see, our lovely Sesame friends.
Yes, well, we love those Sesame friends. So let's start the stage a bit. At this time of year, many military children are experiencing change and transition, as we just mentioned. Children and caregivers may be relocating, they may be entering new school communities, meeting peers and teachers, settling into new spaces. This can lead to big emotions for children and for their caregivers. So what can parents and caregivers do to help children with these transitions? And how can caregivers take care of themselves during this really challenging time?
I think you said it so well, Kathy. It's the idea of how do we prepare for these transitions. And the fact is that there's actually stages that we can prepare for. And second, to communicate about those stages. First, in any transition, especially one that's relocating, meaning that we are moving to a new location, new home, new school, the idea is to think of it first, how do I prepare for as a family from the very beginning? And that is, don't hold off until the very last minute informing. Plan ahead, inform your little ones, and plan together how you can make that transition. Pack things that are very, very special. Start to indicate where you're moving to. And then the next stage is also the actual moving or relocating and the time that you're spending to get there. It's often, especially for young children, very important to have objects that you can move with, something that's very familiar. And that is whether it's a stuffed toy, is it a picture, or something that's a memory. The other last stage is once you're there and how you're planning ahead. The advantage of technology is that even before we move, we could sort of see our environment. We could know where things are. We can even look at what the home may be looking at. So again, as much as you can pre-introduce, but then make those special places in that new home. Make sure that you're mapping it out and making it friendly. Lastly, as you mentioned, believe it or not, relocating or these transitions are equally stressful for both adults as well as children. So having that self-care and similar transitions that I just talked about is very important. The full advantage is that we've created incredible resources that are on sesamestreetformilitaryfamilies.org. And I know you'll be placing that information in the chat. These resources really help that ability to transition.
Well, that's super. Meeting new people in the community also means meeting a new healthcare team, and we are really focusing on health with this town hall. I understand that Sesame Street has some new resources and new thoughts to getting settled in with a new healthcare team.
We do. And one of the things that we have done, believe it or not, have had a wonderful partnership with the Department of Defense and particularly the Defense Health Agencies and also community and family work. What we've done is always anticipate what are the greatest needs for families from active duty as well as our veteran families. In so doing, we actually do quite a bit of on-the-ground research. And one of the biggest occurrences was really how do you not only transition physically, as we just described, that idea of how do we prepare for physical relocation or going to a new school or these elements, but then the other fact that came up is how do you transition as my healthcare is also being transitioned? How do I maintain that connectedness, especially as a family, and especially if I have medically complex children, if I have, for example, children who have special needs, or there's a chronic illness. So the idea is, once again, we have resources for that, assisting in ways that we can create that transition. That transition allows for a couple of things. One, what is the physical sort of technology transition? Meaning, how do I ensure that the medical records are forwarded? How do I also then, once I'm in my new location, create what we call a wonderful healthcare team? And that healthcare team is not only the health providers, but for young children, we know that it's also what we often call the circle of care. And that is, in order for children to be both emotionally and physically healthy, we need to be connected with our healthcare provider, but also children's educators and also extended family members. And how do we assure that that group is very knowledgeable about both health well-being?
I understand you have some short videos on these topics. Shall we cue them up?
Well, yes. One of the videos that we have in creating, let's say, that transition, and especially having, for example, an idea of how to provide comfort when you're making a move is something that we use a strategy called comfy, cozy spaces. And that can occur in any situation, whether it is that you're moving to a new location, whether it is, let's say, that you're going to a new school or even starting school. Having this wonderful little safe place in your home, a little corner, and we often use the term systematizing. So let me show you how Big Bird actually created a comfy space with his nest.
Hi, Big Bird. Hey, Big Bird, you okay? How are you feeling?
No, not too good, Alan. Yeah, I've got all these feelings, you know?
Are they big feelings, like
Yeah.
sad or
Yeah.
angry or
Yeah.
confused,
Yes.
anxious?
Yes, it's all those feelings, and they're all mixed together, and I don't know what to do.
I understand. Now, picture yourself in a place where you feel calm and comfortable, right? You can look any way you wanted to.
Oh, yeah. Birdseed cookies, fresh out of my Granny Bird's oven.
Oh. Tell me about your Granny Bird.
Oh, I love her a lot. She's sweet, and she's caring, and she made my favorite blanket. Just thinking of Granny Bird always makes me happy.
Aw, that's amazing.
I hope we all got a little bit of comfort from Big Bird.
Yeah, absolutely. I did. Yeah, I've got another question for you. An active duty Army spouse in Cameron, North Carolina asks, how can my family build and maintain good mental health practices for the school year? They're not only dealing with the big changes coming from COVID-19, but also the challenges that come with a recent PCS and the overall military lifestyle. Any thoughts about that?
Yes, I think a couple of things. One is to acknowledge the overall military lifestyle. We often assume that because we are a military family and we have so many transitions that the resilience is sort of built in, and these transitions are really not as challenging. The thing is that all children, regardless of whether they are military families or veteran families, are really very, very special and unique. And we need to first acknowledge, as parents and caregivers, we know our children, and we should always sort of be tuned to their nuances. In terms of looking at mental health, we should look at it also holistically. One, that it is children's physical well-being. We need to be physically healthy and have, again, that circle of care to support that. The second is almost what we just saw with Big Bird, that idea of how do we express big feelings and little feelings, and both joyful feelings as well as challenging feelings. And those are emotional health. How do we provide ways to support that? And once again, we have a variety of resources that help do that from a child's point of view. Lastly is what we call social health. And that is that all, whether you're a grown-up or a child, need peers, need people, need the community around you. And so mental health is really quite complex in sort of making sure that all of those three factors are really balanced. Lastly, it's the idea that we model as grown-ups for our children. So the equivalent of self-care for us is just as important as it is the self-care for our children. And so keeping that balance of us as adults as well as for children is very important. Lastly, we often do what we call very basic strategies in everyday moments. And so we have another little video that shows what we call a self-hug and how sort of supporting yourself by even just a hug is so important. So we can
Today,
show
the
that.
letter of the day is H.
And H is for hug.
Oh, and hugs always feel so good.
Oh, yes. Sometimes when I really, really need one, I hug myself.
Rosita, that's a great thing to do, no matter how you're feeling.
When Elmo's feeling scared, Elmo gives himself a hug. That's better.
When I am feeling happy, I give myself a hug. One wonderful hug.
When I'm angry, hugging myself really calms me down.
Oh, when me feeling sad, it hugging time. Yeah, there, Cookie Monster.
When I'm feeling lots of different feelings, all at the same time, really big feelings, I give myself a big hug.
Hugging yourself is something anyone can do anytime, even grown-ups like me. Yeah.
Well, that was awesome, Jeanette. Thank you so much for sharing this. I feel like I may be the first person to convene Dr. Fauci, the head doctors, and the VA DD, and Elmo and Big Bird. So that was pretty exciting.
I agree with you. It was very exciting to be part of this amazing group. So thank you.
And what a great way to end. Thank you for sharing these great resources, which I think is going to be so much help to our military and veteran families and for their kids.
Thank you.
And thank you to all of our amazing panelists who joined us today. And thank you to all of you who are watching. We're really honored that the Department of Defense was able to stream this as well, so we had a big audience. We know that getting back to school, back to work after a summer full of change, full of fun, but also full of COVID can be daunting. Routines change on top of an already stressful military or veteran lifestyle, and that can bring even more stress. At Blue Star Families, we hope to make your life easier. For those of you who registered through Blue Star Families for today's event, we'll be sending a post-event email shortly with many of the resources available to you. You can find the recording of today's town hall on our website. Thank you again for joining us today. Have a great afternoon.